So thyroid. Dr. Richard Shamus in Thyroid Power said the major symptoms of thyroid are so common today, they're considered normal. Low energy, marginal health, and overweight. And so that's why oftentimes thyroid is tested with TSH and T4, and that's about it. And it's treated very regularly.
I'll ask the question later.
Okay. So this is the reference that I showed you earlier, but this is the rest of it. The obese have more toxins in their fat than lean individuals, and when they lose weight, a decrease in that fat mass results in the release of the toxins, and these toxins in the plasma result in disrupted thyroid function and a decrease in your resting metabolic rate. You burn less calories, and what we'll see in just a moment is that the thyroid is the most important organ or gland in the body to control metabolism. So toxins have a direct effect on thyroid, and the most common ones are organochloride toxins. These are things like chlorine we find in our water, fluoride we find in our water. They're put in there because they think that they help. But the problem with that, and the chlorine that is in pools, and the fluoride that's in our dental hygiene products, toothpaste and mouthwashes, the problem with those things is that they're halogens, and they fall in the same periodic table column as iodine. Well, iodine is necessary to make thyroid hormone, T4. And if we are deficient in iodine, which a lot of the U.S. is, especially in the Great Lakes region, it's considered the goiter belt of the United States because all the soil is deficient in iodine. When you're deficient in iodine, the body will take up some other halogens because they're similar in chemical structure and try to make thyroid hormone. And of course, it's not real thyroid hormone, so it's not working very well. And it's not going to stimulate metabolism like it should. That's why organochloride pollution is a new factor in control of thermogenesis in people. In the 1997, the EPA said hypothyroidism is typically the result of environmental toxicity. That's a big one. So we got 4 iodine molecules make up T4. If we replace the iodine or the iodine with one of those other halogens, chlorine or fluoride, bromine, which is also in a lot of things. In fact, bromines are in the PBDEs that they were talking about in that video, which we're going to see in a second. There's also some other things to consider. Hormones affect thyroid function. An increased estrogen to progesterone ratio increases autoimmune thyroid by 3x. PCBs, PBDEs, and bisphenol A bind to thyroid receptors and have selective effects on thyroid receptor functions. They also think phthalates, which also they showed in that video, can have such effects, the same effects. And then they believe endocrine disrupting compounds affect the hypothalamic pituitary thyroid axis, the HPT axis. And you put the adrenals in there too, because they really do. When we're exposed to toxins, you actually increase cortisol and catecholamines from the adrenal glands. So it's well known that toxins affect the thyroid. And the reason why it's important to talk about the thyroid and weight loss is that Geig's textbook of medical physiology says thyroid hormones have 2 major effects on the body. Number 1, increase the overall metabolic rate, so how well and how fast we're burning calories. And 2, in children, it stimulates growth. They go on to say that the thyroid hormones increase the metabolic activities of almost all of the tissues. And I've seen somewhere around 95% of our tissues in the body are affected by thyroid hormone. That's why it's so important. Now you'll go to your doctor and get a TSH, maybe at most some TSH regularly, and at most they'll add on T4 for that, especially if you're being treated with synthetic thyroid hormone medications. But that's not a good picture of how the thyroid's working. That's only telling you that the thyroid's not working. If you do a comprehensive, thorough thyroid assessment, which are these 7 parameters, you can actually tell what's going on with the thyroid. Is it sugar? Is it acid? Is it autoimmune from estrogens, or is it autoimmune from food sensitivities? You can actually tell what's going on with the thyroid, not just that it's malfunctioning. So I like to follow Dr. Richard Shamus's statement and goal, and that is with thyroid therapy, it's not to have a normal TSH or a normal T4. That's not what I shoot for, because that's easy to do. The goal is to have a normal patient. We want to make sure things are working well and you're feeling great and your body composition is normal. So if you have these tested, some doctors will do all of these. Many won't. Most won't, in fact. You can also do axillary temperature at home. This is really easy. for 28 days. You chart your temperature when you wake up in the morning. You don't get out of bed, you don't do anything. All you do is roll over, you pick up the thermometer, do your temperature, and that axillary temperature should range between 97.8 and 98.2. And if it's lower than that, that's subclinical hypothyroidism. If all those other numbers are normal. But so I recommend, since we talked about many of the things that affect thyroid, see again a health coach, somebody who can help you change your lifestyle and improve some of those things we talked about: hormone balance, toxicity, things like that. The next one's brain chemistry. It's obvious that there are strong relationships between obesity and psychological factors. This is well known. You're going to see lots of references. Anybody seen Austin Powers movies?
Yes.
Fat bastard. It's funny, yes. And actually, I like Mike Myers a lot. But he's got, at the end of, I think it's Austin Powers 2, he's got, you know, a line in there that's really good. And right before he's ready to kill Austin Powers and, you know, his female sidekick, the female says, "Wait, I have a question to ask you. Are you happy?" And he goes in this long rant, and, you know, he's like, "Of course I'm not happy. Look at me, I'm a big fat slob," and, you know, says some profane things. "I haven't seen my Willie in 2 years, and, you know, it's long enough to consider it legally dead." But he goes into the most important part and says, you know, "I can't stop eating. I eat because I'm unhappy, and I'm unhappy because I eat. It's a vicious cycle." You know, and he puts his head down, he says, "If you excuse me, there's someone I have to get in touch with, myself." You know, and he turns around and walks out, and he doesn't kill him. And, you know, it's true, though. That's a lot of times what's going on with people. So this is International Journal of Obesity, says the interrelatedness between obesity and psychological problems seems to be twofold, in that clinically meaningful psychological distress might foster weight gain and obesity and lead to psychosocial problems. Thus, are the most frequently implicated psychosocial factors are externalizing, which is impulsivity and ADHD, and internalizing, depression and anxiety. And these problems lead to uncontrollable eating behaviors. It's very, very common. But there's also good news. Happiness can also be contagious. So if we look at, actually, I guess I'm jumping the gun. Something to really pay attention to, I guess, is that obesity is contagious. And this is the British Medical Journal. Actually, let's start with the obesity one. Sorry. New England Journal of Medicine said that after they followed 12,000 people who had been closely followed for 32 years, people were more likely to become obese when a friend became obese. And that increased that person's chance of becoming obese by 57%. So when we talk about psychological factors and obesity, well, being together in that psychosocial, I guess, environment, maybe you can speak to it better than I can, but that environment, when you're with people, you start to develop the behaviors and the thought processes that they do. And so it's important to consider that in that environment that you're in. But also some good news is that happiness is also contagious, just like obesity. Researchers looked at 20 years of 5,000 different people, and that found that when any one person was happy, their friends became more likely to share in that joy, and the benefits spread out 3 degrees of separation. So their friends' became happy as well, just because you were. Dr. Joel Evans, who I'm actually going to play right now, he says it best. He's an OB/GYN out of New York. We interviewed him on Health Insight. And here's what he has to say about love and weight loss.
Love really is about loving yourself enough to eat what you're supposed to be eating. And it's no secret that even though this country is suffering from an obesity epidemic that's getting worse and worse, the information about what we should be eating and what we should be weighing is out there. So it's not that people walk into a fast food restaurant and think that these large-sized portions are actually good for them. We've demystified that. We know what we should and shouldn't be doing, but we each have a block that prevents us from doing that.
Love and weight loss is about loving yourself enough to eat what you're supposed to be eating. And that's a big aspect, okay? That's a big factor in health. And so if you guys feel like you have some challenges there, it's important to talk to somebody about it, okay? Also, food sensitivities can affect brain chemistry. Celiac disease, which is a permanent intolerance to gluten, is associated with an increased prevalence of disruptive and depressive behavioral disorders. Neurological disorders such as autism and schizophrenia, much more significant than what we're talking about today, but they're associated with milk consumption. Food sensitivities, especially the allergenic foods, have effect on our brain. Now, one of the reasons why these two I pointed out is because, let's take dairy for example. It actually comes with caseomorphines. These are proteins that have neurological aspects, just like morphine, and they'll attach to morphine receptors in our brain and stimulate the feel-good feeling. So dairy becomes addictive. Now, if we look at babies, anybody have any recent experience of nursing children or seeing children be nursed?
Not me, but my clients.
Okay. Well, have you ever seen what the babies look like and do after being nursed? Like we nursed my son, and he nursed off and on until he was 18 months. Not years, months, and it was very clear. You're right. It's a baby drunk. We call it the milk drunk. After they're done, they're just so happy. And that's because those morphines come in the milk, and they're meant to be there. And the reason why is in nature, if an animal or humans steered away from their mother who was nursing them, they wouldn't live. They would die. And so it actually brought the infants back to the mother to keep drinking and living and getting the nursing that they needed. Glutamorphines are also produced, and especially by the gut. We can make glutamorphines that come from gluten, and that's one of the reasons why it also affects the brain. If you suspect brain chemistry imbalances and you think it's more specific than just, you know what, I could use a little bit more love in my life, here's some good testing for that. I like neuroadrenal testing. I do that with urine and saliva. Stool analysis. The metabolic syndrome criteria is huge, by the way. I have another slide that I took out of here. It shows that metabolic syndrome is a precursor to depression, as well as people who are depressed are at more likelihood of becoming metabolic syndrome because of the vice versa thing. Organic acid metabolites, and then food sensitivities. This looks at metabolism and also has some neurotransmitter testing in it, but the LCAT looks at food sensitivities.